Hi everyone, I'm Georgie Pipkin. We're here live in the Baptist Health Newsroom. Great topic for us today. We are talking about the holiday stress. We are experiencing a time where people are having magical moments. It's Christmas, the holidays are coming up. You might have family coming in town and everybody's merry, but there's also the stress of traffic in South Florida, weather changes, not too much here, but we're happy to have experts here today to talk to us about how to manage that stress and really keep healthy throughout the holiday season. So with us today, we have Amy Exum. She's our psychotherapist from Baptist Health. We're happy to have you here to give us some tips on how to manage our stress. And then we also have Dr. Jonathan Fialco. He's our Deputy Medical Director and Chief of Cardiology and a certified lipid specialist at Miami Cardiac and Vascular Institute. So thank you both for being here today. We're really excited about this topic. We know people have been asking us questions. So as we always do with Facebook Live, if you have questions, we'll answer as many as we can at the end of our chat today. So feel free to type in on Facebook Live, ask your questions, and we will get to as many as we can. So welcome. Thank you for being here. Amy, I want to start with you. Let's dive right in. I think, a lot of people have different kinds of stress, whether it's family coming in town, traffic. Talk to us about the different types of stress that many people have. I've seen a couple of studies that say this time of year really increases that anxiety. So what kinds of things are people experiencing nowadays or this time of year?
Sure. I think you hit a lot of the main ones. And then we're also thinking about financial stressors with the gifts that people are trying to get, Amazon package deliveries. I know that it sounds really silly. It can sound really silly, but are these packages coming on time? Is my Christmas gift going to be making it? So we have all of that making this a really special time of year for the people that we love and care about. So it can get really overwhelming very quickly when we talk about all those different factors. And then don't forget, on top of that, we're doing everything else that we typically do all year round. So we still have picking up kiddos from school, we still have our job responsibilities, but now we have workplace gatherings, workplace gift exchange, holiday parties for a kiddo's school. I can go on and on. But this time of year, it's pretty typical for people to be feeling the stress that comes along with it, along with the joy.
So what can people do? They're trying to manage this stress.
Right.
What are some tips for maybe breathing, or you tell us what can we be doing? I need tips myself. I'm already stressed out and I have 6 days to go?
Right, 6 days to go, countdown. So, I say I have three big things that I'm thinking about. And the first one is maintain your routines, right? So if you do go to the gym once, twice, 3 times a week, keep going to the gym as best as you can. Make sure you're getting enough sleep. Make sure that you're still having that healthy diet. I know it can be a little more challenging, right? When we have so many delicious things and desserts in front of us, but try to maintain that diet as best as you can. My second tip, it's okay to say no. So it's okay to say no to extra gatherings, stopping by people's houses. If you're really tired, let the other people know. I'm sorry, I've got so much going on. I'm so tired. Can we do this another time? You can also say no to that extra dessert or that extra drink. And then my third tip is also just to remember to prioritize yourself, right? This is really about you and enjoying the holiday time with your family. Get back to the basics. What is this all about? It's about reflection. It's about sharing time with the people that we really, really care about. And so don't forget to do that. Are these things that you're doing during the holiday times really bringing you joy? And if they're not,
scratch it off.
Scratch it. Or maybe I just need to reshift my thinking, and instead of trying to have the perfect dinner, the perfect tree, having some fun with it and saying, you know what, it's not great, but at least I'm with the people I care about.
I should mention too that if you really are experiencing stress or you feel like you need to talk to somebody, we do have Baptist Health Care on Demand. And now through the holidays, we're offering a special promo code for a discount. You can type in holidays in the code and you can speak to somebody like Amy who can kind of offer some tips. And if you're really feeling lonely, can get you some real professional help. And so with that, Dr. Fialco, I want to talk to you. I know I had a family member recently who was experiencing this high blood pressure, and they may think they're going about their regular activities, but really the stress can go hand in hand with like a heart attack or really a panic attack. So talk to us a little bit about that and how that can affect someone.
I think, and it's something I and others have recognized, and we've actually adapted our practice towards the few weeks before Christmas, knowing these stress-related issues. More importantly, from the practice standpoint, is when you're struggling to get all these holiday-related duties in place, what you don't have time to do is get sick. So now if someone has a medical problem, it's even further stressing because they got to get into the doctor's office. The deductible's met, so they want to get in before the resets in January. And they still have to shop. So again, there's a lot of extra aspects of getting taken care of from the health standpoint that have to take into account. And from that, one of the things to add to what Amy's excellent points were is it's take all those things but plan them. I actually tell a lot of my patients by Thanksgiving, okay, now it's time to do your holiday planning. Plan the time you're going to need for this. Planning that it's going to be traffic so you can't run out during a lunch break to get to the mall and do something and try to anticipate some of that stuff. But going back to the medical issues, yeah, stress leads to hormonal changes, adrenaline, cortisol. These are real physiological reactions when we have stress, which is accentuated and exacerbated around holiday time. And those things can raise your blood pressure, cause palpitations, those stress-related complaints. Something I tell patients as well is try to cut your caffeine a little bit around holiday time. Caffeine's very healthy. It doesn't really have anything bad, doesn't do anything bad for you, but it enhances, it's a stimulant, enhances stress. So you drink a lot of coffee, you're trying to get everything done, and now all of a sudden your heart's racing, you feel tight, you check your blood pressure, it's high. Your blood pressure could be high because you're stressed, or high blood pressure could be causing stress, and then you say, oh my God, what do I do? I got to get to see my doctor. I'm going to go to an emergency room. I don't have time. So this all cycles around. So going back to the original premise, what can people do? Again, exercise, good night's sleep, big transitions. I'm an empty nester. My wife and I, we go to sleep 9:30, 10. We wake up at 5. My kids come home in the 20s. The house is chaos.
Yeah.
I love it. We're going to sleep at 1 in the morning. They're sleeping till 10. I'm still getting up at 5.
Right.
So, again, I think it's very important to accommodate a good night's sleep, but make sure you take your medications. Make sure you have your medications. Don't run out in the middle of the holidays because that's going to put you at a disadvantage. If you have things you need to do for your time constraints, make sure you plan them and anticipate them, including speaking to your doctor. Getting a flu vaccine. It sounds silly, but get a flu vaccine when it's the season so you're not sick or getting sick or giving it to someone else during the holiday time. So these are the things people don't think about that can really impact their health.
Yeah, places might start closing after that time frame after the holidays.
Right.
So now you still have time to get to those places, whether it's your pharmacy, get the medication you need, speak to your physician for whatever it is that's coming up.
Right.
Talk to me about panic attack and anxiety versus a heart attack. What's the difference there?
So the difference is the heart attack. So basically a panic attack is a heart attack without a heart attack. So what does that mean? When someone's having a heart attack, it's because a blood vessel to the heart is blocked and the heart's not getting blood. Heart muscle is dying. So as you can imagine, your body's under stress. Your adrenaline level goes up, your heart rate picks up, you start being hypersensitive to things, you can't breathe. A panic attack, which by the way is a true disorder, it's not I'm just a nervous person. A panic attack is a release of adrenaline. Your body is releasing adrenaline into the bloodstream that's not appropriate for what's happening. If I'm coming at you in a dark alley with a knife and your heart starts racing, you feel stressed, that's totally appropriate. When you're sitting watching TV and your body releases adrenaline and your heart starts racing, you start getting chest pain, that's a panic attack. So how do you differentiate a panic attack between a heart attack is sometimes difficult. And the first way is, am I really at risk for a heart attack? So, a 22-year-old healthy woman who starts feeling chest pain and shortness of breath, probably more a panic attack. 65-year-old diabetic smoker, even if it's a panic attack, you want to get checked out. So again, part of it is try to take relaxation techniques, deep breathing, meditation, try to bring your adrenaline down. If it doesn't get better with a certain period of time and you're really uncomfortable, you might want to either call your doctor or even more so, go to the emergency room. Because if it is a heart attack, the longer it takes you to get taken care of, the better. And if it's a panic attack, we don't want people going to the hospital every time they feel a little anxious, but if it's a true panic attack and you're not sure, you don't want to make that mistake. But the symptoms of a panic attack, you have to have 4 of these symptoms, which include chest pain, shortness of breath, lightheadedness, feeling of something bad happening, tingling around the face and the fingers, nausea, heart racing, if I didn't say that already. You need 4 of those to meet the criteria for a panic attack. One of the others I will tell you is that tingling, if your fingers are tingling and your mouth is tingling, that's usually more panic attack, less heart attack, but I wouldn't use that as a differentiator. But yeah, these overwhelming adrenaline releases can mimic heart attacks, and sometimes it's very difficult for the individual to differentiate between the two.
Good information. I think we should also dive a little bit deeper into where to go. So sometimes people are unsure of where they should go. I know in Baptist Health we have several options. You would go to your primary care physician, for example, for just an annual checkup that maybe you've done throughout the year. Then you have your urgent cares where you may go if you have the flu or you have pink eye or something during the holiday season. But for heart attack, it's a little bit more serious. So you're going to want to get to that emergency department at the hospital. Correct?
Unfortunately, one of the more common reasons people visit emergency rooms in the United States is because of chest pain. And of course, it's the uncertainty is, am I having a heart attack? And the majority of the time, it's not a heart attack. But that's what you have to do. You don't want to miss that. You don't want to go to an urgent care. You don't want to wait to see your doctor 3 days later if you're having a heart attack. So we will accept a lot of people going to emergency rooms with chest pain or heart attack symptoms that are not, knowing that we don't want to miss the people who are truly having heart attacks.
Exactly.
So again, if you're going to use various resources, your primary care doctor, the Baptist Health Care on Demand, which is a wonderful resource, there's certain kind of things you might be experiencing where those would be the right resources. But if you're really having chest discomfort, if you can't breathe, if you're sweaty and it's a cold sweat, if people look at you and say, how are you? Something's going wrong, you look bad, don't mess around. I would argue, call fire rescue, let them see you and stabilize you and take you to the hospital. Even if it turns out to be something that's not critical, better to find
safe
out that
than
way.
sorry.
You don't want to drive yourself to the hospital either. Call fire rescue, because if God forbid you're having a heart attack, you can have a sudden arrhythmia and die in the car to the heart attack. Fire rescue's there. It's less likely to happen.
And the other important piece is really, you were mentioning just a moment ago, to have somebody drive you there. So you don't want to drive yourself, correct?
You really, if you think you're having a heart attack, you're calling fire rescue.
Okay.
Don't even let someone else.
Direct to 911.
The quicker they get to you, you are now monitored. You're stabilized.
Perfect.
If something catastrophic happens, they're there to take care of it, like an electrical arrhythmia where they can shock you. If you're a passenger in a car, that's still not right. So we do recommend. I know it's a high level resource, but if you think you're having a heart attack,
you want to get the best care as soon as possible.
Correct.
And Amy talked a lot about some of the tips to manage stress, and I feel like from what you've mentioned, it's similar tips, for reducing the risk of a potential heart attack. But maybe it's also eating healthier. Try to stay away from the 10th donut at the office because it's another holiday party. So what are some things, Amy mentioned a few, anything else that we should think about to kind of reduce the chances of a heart attack?
Again, first, obviously stay healthy the rest of the year. It's not
as best you can.
Right? So, the more you maintain your healthy lifestyle, which can include proper eating, avoiding processed foods, trying to keep your weight under control, exercising. I think Amy mentioned something that's really cogent. And I think we're really underemphasizing how important a good night's sleep is. Sleep is a major component of our health. And sometimes when we stay up late looking at bright screens, or husband snoring, or the dog's barking, you don't get a good night's sleep, there's medical consequences. So I think the healthier you are during the year, the less likely it's to be exacerbated during the holidays. But for those at risk, and the holiday stress does increase risks of heart attacks and problems, I think it's to, again, plan and maintain those lifestyles. Exercise, take your walk, go to the gym if that's appropriate. Good night's sleep. Yes, you're going to be surrounded by a lot of food. You're going to have a lot of excitement about family. Plan it. Don't do it every meal, every day, because again, even that rapid weight gain can obviously put stress on your body. So again, alluding to Amy's point, the more you plan and maintain your healthy lifestyle, the better it's going to be during those periods of time. And it's okay to turn things down. It's okay to say, I got to take care of myself and concentrate on what's really important. And I think those are the tips that we're really looking for. And I said before, because it happens so frequently and we get those calls on Christmas Day, don't run out of your medications. Yeah. Make sure you have enough through the holidays, because it's going to be hard to find a pharmacy to fill it. It's going to be hard to find someone on the phone to call it in. Make sure you have enough in advance. It's really important.
What about, you talked about scheduling and planning, try to do things ahead of time. What about setting parameters with family members, whether it's the dinner table discussion, like no politics are allowed, or maybe it's, we can.
What kind of politics stress could there be in this thing? I don't know.
So, because I think maybe people add to the stress, like, oh no, I got to go to this family dinner and so-and-so's going to be there and I really don't want to talk about X. Or, I imagine that increases the stress level for some. So is it maybe good to say, hey, everyone who's coming over.
I have an observation on that, but I'll defer to Amy first.
And we don't need to get into politics, but maybe it's, or so-and-so's coming with a newborn and there may be an extra crying baby. Or
you do see, and again, where I sit, big clinical practice, people coming in where, as Amy alluded to, it's such a festive time and it's a spiritual time. It's about family and connection. And people lose that. And sometimes it's like you said, I hate my sister-in-law. I can't believe she's going to be there. And these dynamics that get in the way, that's unfortunate. But I'll let Amy solve that.
Yeah, I think so. One of my biggest recommendations is that the holidays are not the time of year to try to resolve huge family conflicts that have been
Good
brewing
idea.
that have been brewing for years or decades. That's not to say that we can't put our differences aside and really bring the focus again to family and what Dr. Fialco was saying. So maybe you can set some ground rules. Hey, this is what my goal is for tonight's dinner, for our gathering. It's for us to connect. It's for us to share how much we care about each other and to reflect on the good times. So whoever mentions politics first, guess what? You have to pay for dinner.
Yeah, there you go. I like it. It's good.
But
I'm so
bringing a lighter tone to it, because I think there are a lot of expectations. What's it going to be like? I've been having this argument with this person. I don't agree with what they say. Right? I disagree with a lot of people, but I can still get along with them.
Yeah.
So again, it's about reconnecting. What is it that we really care about here? And let's put everything else aside. And sometimes we might have to flat out say, I'm really here just to connect. And so this doesn't really help me do that with you. This is where I want to be with you. I want to share this moment. And sometimes you may not be able to say that directly, and you'll just have to redirect the conversation.
Yeah, and just planning that ahead of time and
Planning them
knowing
ahead of time.
these are some of the things that I would say if this comes up is helpful.
Absolutely.
And maybe de-stress a little bit.
Letting people know your limits. So I'd say
Yeah.
one of the big things people get really concerned about is what time are people going to leave my house? Because I'm the one who has to clean, and I'm the one.
Yeah.
So let people know ahead of time, hey,
Great tip.
this evening I've got such and such to do, and I really need to be productive for the next day, and I love having you here. If you want to stay later, are you willing to help me clean up? But just letting people know that this is when we're going to be wrapping up, because we have other things that we need to get ready for.
Great tip.
If you let people know why you want to wrap up, it's not because you don't want to be with them, but it's because you're tired, you need to get your night's sleep, you have things to do tomorrow.
And that's incentive
People miss those
to
non-visual cues sometimes.
Yeah, sometimes because they're having
putting
a great
an end
time.
time on the e-bite.
Right.
Or knowing, hey, we're going to really try to start on time. Don't come an hour
Exactly.
late. That's very typical here in South Florida, being late to everything. But maybe we say, try to be on time so that we really do have that time together and not
Exactly.
go into the night.
Exactly.
What about, I'm thinking of elderly, maybe there's a grandparent who's alone this time of year. I think we hear sometimes that there's depression, kind of peaks at this time. Holiday blues, those people that maybe
loved ones you've lost.
don't have family members or loved ones that we've lost. Anything that we can kind of do there to manage that lonely or depression for folks?
Sure. So sometimes it's creating new traditions, and for those people who've lost someone and who don't have someone this time of year, is creating a new tradition, something that you can do to honor them, something that you can do with family members. Again, that's that reconnecting. And it's also just keeping in mind some of those people who maybe they're not direct family, but they're friends. And maybe it's an extra text message. Maybe it's stopping by to visit them. And I highly recommend volunteering, giving back to the community. It's a great way to practice gratitude. It's a great way to get out of the funk of what are minor stressors, like the cake isn't perfect, but in the big picture, it's not a big deal. Going out, volunteering, giving back to the community is a great way to get out of those everyday stressors and really be there for somebody else.
Great information. I know we're starting to get some questions in, so we'll take them as they come. And I'm seeing from a viewer, can you tell the difference between stress and depression? So what's the difference?
Good question. So stress, and Dr. Fialco, correct me if I'm wrong, stress is really the body's reaction to any changes that we're experiencing. So a temperature in the room changes, our body's going to react to that. That can be considered a stressor. So stress over long periods of time can result in mental health issues like depression. So, if you're going to see a therapist or a physician, we're going to ask you, how long have you been experiencing these symptoms? What do these symptoms look like? Are they seasonal this time of year? Is it because of a big stressor that happened, some major life change, or has this been going on for some time? We're also going to be looking at family histories. So at initial look, we'd have to do some more digging to really understand if it's stress or depression.
If I could add to that, and again, I agree 100%. Both of those words can manifest in different ways. 5 people could be stressed, and each one's describing completely different symptoms. Depression can be sadness. It could be apathy, lack of enjoyment, fatigue. But sometimes I think the connotation is we confuse anxiety with stress. So what stress is, as Amy said, a true physiological reaction. Your body's releasing these chemicals that have consequences. Anxiety is the result of uncertainty. How am I going to pay my bills? Is my grandson going to go to college? Or what is this mole? That uncertainty leads to anxiety, which is a how do I find this certainty? And people who are very anxious might get a lot of uncertainty over minor things where other people might not care. But I think there's a little differentiation between anxiety, which can lead to stress, and stress. So sometimes we confuse that term. You can be anxious and stressed, and they can be two separate but related things.
And I think a lot of people use them interchangeably nowadays.
Right.
Yeah, you do hear.
And they are related.
I'm stressed out, or it's good to kind of dive deep into what each individual thing means and kind of what the symptoms are, so you can get to a better. We don't have any more questions, but I wanted to open it up to you guys. Anything we missed? Any final thoughts or tips?
I was just thinking we would be remiss if we didn't bring up also alcohol.
Okay, great.
So again, alcohol, which socially is certainly fine, but obviously can lead to problems if you drink excessively, both in terms of physical complaints, cardiac stress, other stresses, blood pressure stresses. So we do want to have fun, but we also want to moderate our alcohol consumption during the holidays. And sometimes, especially for a long social engagement, you may be drinking a little bit, but over the course of the night, it's a lot. So I think it's something else we should be aware of and plan what our
ahead of
alcohol
time.
consumption
Maybe if you know
will
you
be.
have 3 functions,
Right,
at these
moderate.
two,
and certainly
moderate.
you could have 1 or 2 drinks at one, and you're going to get in your car and go to another one. So that's the other thing. Uber as best as you can. Don't drive from place to place and party hop when you've been drinking.
Amy, any other tips, last thoughts? I know the breathing is helpful. Like,
sure.
We mentioned Care on Demand. If you really need help from one of our experts, feel free to dial in and use that service. Anything else?
I think this time of year is a lot about reflection. You hear people thinking, what did I accomplish this year? What's happening? Oh my gosh, it's next year. So it's a really good opportunity to reflect on, what has happened in the past year? What do I want to change for the new year coming? And, do I have any stressors that I feel that I can't manage right now? And if that's the case, then maybe I can reach out to talk to someone about, reorganizing and reframing my life. There are a ton of apps out there for meditation, for mindfulness, like Breathe and Calm, Headspace. And then there's a really good app that I just started using. It's called Jour, Jour. And it's a little bit about journaling and gratitude. So you get a little bit of both in there. But it's just a good time to reflect. Remember, get back to basics. Focus on the family and what you really enjoy.
And I know we have a National Suicide Prevention Hotline number, so we're going to put it up on our screens. The number's 1-800-273-TALK. TALK is 8255. So if there is an issue, you have a family member or a friend, or you're worried, use that number, even if it's for yourself. I know, Amy, you had another text option.
Yeah, so there's a text crisis line. It's 741-741, and if you text home, a crisis counselor will reach back out to you immediately.
Okay, great. Those are both great tools, numbers, and things to use throughout the holidays when maybe there's a kind of a downtime, offices are closed. You have things in your back pocket, on your phone, apps, numbers that you can utilize throughout the holiday season. So we really appreciate you guys being here with us. We have lots of good advice. I know I took some things away that are helpful, setting some parameters, scheduling some things out. We still have a few more days to get things in order. Remember to follow us on social media. Our handles are right there on the screen. We are on Facebook, Instagram, Twitter, and LinkedIn, where you can find us for news and upcoming events. We're happy to have you guys here as always. I know you'll be back to visit us. We also have information on our website, baptisthealth.net/news, for more information and topics. Feel free to share this content. I think it's so helpful for so many. So again, Amy and Dr. Fialco, we are so happy to have you guys here. Till next time, we're here from the Baptist Health Newsroom. I'm Georgie Pipkin. Have a great holiday.
Thanks.
Thank you.